This time last year, Ellie asked me to speak, and we were talking about my light bulb moment in wound management. And really, it's not, I'm going to give you an amazing message today. This is really just to explain our journey down in Dorset of how we basically improved our patient outcomes. Aims and objectives, really, obviously what I wanted to look at was how we target the provision of holistic care within the local community. As I say, looking at how we've improved patient outcomes by encouraging our patients to participate in that care, and how within the current NHS agenda is all about integrated working. We should be working together, and I think that's the one message that's come to me today in particular, is that we're all up here talking about the same things. It's about that patient being at the centre of the care, and I think every speaker today has had that one single message that's come across. And hopefully, just as being the last speaker of the day, I just want to try and bring everything around as to what the whole conference has been about, and the amazing work of the Lindsay Leg Club Foundation and all of the leg clubs out there. Now, I know that there's lots of people out there that run leg clubs. I know there's lots of expertise. So as I say, this is our journey and our story. So, as I say, 3 years ago, our practice, we're a very large practice. We have 32,500 patients. And we cover 4 sites, 4 surgeries. And my colleagues sat in the audience there will know where we are. We had no room in our treatment rooms. We were completely full. Every day it was just back to back of patients. And a lot of them, when I looked at it, I thought, gosh, we're doing a lot of lower limb care here. And what we were having to do was to offer those appointments first and fit everything else around it. And if any of you do work in primary care, you know that we have a lot of aspects to cover. That's why we're general practice. We're not, we cover lots of aspects. And everything is important to the patients, whether that's their immunisations, doing smears, whatever it might be. So they all have equal importance. And we were really struggling. So I did a bit of an audit of our appointments and found that 50% of our appointments were for lower limb care. And in general practice, that's huge. And I also spoke with our district nurse colleagues, and again, those of you out there that work in the community probably will understand, you're probably 65% of your work is in lower limb care. That's a huge demand on your service. And I looked at our reoccurrence of ulceration rates, and they were about equal to the national rates, and we've just heard about that. And so a lot of our patients were I just felt patients were going through this same circle. And I'm sure you all sit there and understand that. This constant circle of healing, well done, now off you go, here's your education, go away, look after yourself. Knowing that we're probably going to see them again in a few months' time. So they go through this constant cycle. And we were seeing that repeatedly in practice. And that wasn't down to any of the poor care they would be given. They would be given excellent care. But it was just that vicious cycle. I looked at our local community, and if any of you know Poole in Dorset, we're by the sea. We have quite a high population of elderly patients. And a wide variety of social classes. So our demographics were, particularly very high elderly population. And a lot of the patients that we were seeing, again, I'm sure you can all associate with this, were quite isolated, because not only maybe they were struggling to get out of the house because of either their age or disabilities, but then suddenly they had to go out with a smelly, leaky ulcer. They weren't getting out, they were staying, and we were finding that a lot of our members, our patients at the time, were coming into surgery, and they were quite low in mood. They had low self-esteem. They didn't really want to look after themselves. So I looked at all of this, and this is my light bulb moment. I thought, we've got to do something else. We can't keep repeating this cycle, because we know that it's an ageing population. This is only going to get worse. How are we going to manage? I can't keep just employing new nurses. I don't have the space. We don't have the finances. We're constantly told that. So we needed to do something different. So I started to look to see what we could do differently, what was out there. So I looked at various care models that were out there for treating lower limb care. One option, we were having a bit of a new build, a redesign in one of our surgeries. So one option was actually having a clinic based in the surgery and saying, okay, we'll staff that, whether that needs 3 or 5 days a week, and we'll deal with all of our lower leg care patients in that and have our own clinic within practice. Or I then came across the Lindsay Leg Club model, having more of a community-based club was a different option. And I really, when I looked at it, I thought this could be something different. So I contacted Ellie, and I went to another leg club, which was just inspirational. And I took along one of my GPs who was quite keen in dermatology and lower leg care. And we talked for the 2 hours coming home about how we could try to transform that for us locally. And to me, the one message from the leg club model is that it really demonstrates that true holistic approach to patient care. We needed to break that mold. We needed to do something different, and I became quite passionate about the leg club model. So I thought, right, okay, this is my light bulb. Where do I go from here? Where do I go next? So then it was meeting with my colleagues in practice and in the district nurse team, and seeing if they would come on board with my idea and help me to move this forward. Luckily, there was lots of positive feedback. So the next stage was just exploring that concept with our patients and our patient participation group and the local community. And I'm sure lots of you have done lots of different ways of trying to discuss this with your communities. For us, we had a couple of very successful coffee mornings, and we got the enthusiasm going. And from there, we started to grow our committee. And it just takes that one person to really come on board, and they inspire the next one. So before we know it, one volunteer was bringing her mother, next door neighbour. They all were kind of starting to come on board. So that was our beginnings of our volunteer committee. Next thing, money. What do we do for money? I know a lot of leg clubs do. Their volunteers were fundraise to set up costs. I decided I was going to write a business plan to our clinical commissioning group, and luckily I was very successful with that, and we got our setup costs. So then that led us into looking for premises and equipment and all the other things you need to do. I know we are called the Pool Leg Club, but we actually wanted our own name, and our volunteers wanted us to have our name. So we put it out there. We asked all our patients and our patient participation group, can you think of a name? We've got this idea of this leg club, and we want a name to drive it forward, and the best foot forward one. If you put it into BFF, it could be best friends forever, but it's best foot forward. But I think the really important for me was, as much as we were predominantly at the beginning, it was a practice need. I was also very aware of our colleagues in the community, and right from the word onset, we wanted very much a joint team approach and try to integrate them within the setting up of the leg club there. So it was very much us working together, and therefore we needed to make sure we had core working practices, obviously following all the pathways within the leg club. So obviously next thing which always comes, and I'm sure those of you out there that have gone through this, often the big contender with these things is infection control. I know Ellie's talked to me loads of times about infection control, and it always gets asked. So first, the next step was really liaising both with the CCG infection control lead, but also the community trust, because we wanted to work jointly. And that was an interesting period, because it's amazing how many different policies there are out there and how people have to work quite differently. But it comes down to negotiation. If you want to work together, you just have to work those things out. So we developed our own, following the guidelines, our own infection control and manual handling policies. So the growth of our club. We started in October 2015. I think we probably all looked like startled rabbits in the headlights on that first day. We weren't sure how many patients were going to turn up, and 22 walked in the door. And we thought, well, that's a good start, My figure's actually wrong there. We now have over 300 members currently, and every week we are just getting more new members. We started off in a local church hall, very nice, it was very modern, and was a lovely, lovely venue. But because of the increase in numbers, we were getting to the point where we were sitting on each other's laps, so we've ended up moving to a much larger hall down the road, and we've moved there in December last year. Our average attendance, I know leg clubs are very, very different. For us, we are quite a busy leg club. I think the biggest days was about 45 members that were actually having active treatment in some form. But we on average see about 35 to 40 members for actual treatment, whether that's well legs or having more treatment done. But more members turn up for their social side as well. I got our data, and obviously, we all know how important it is for the data to give to the foundation. And just prior to doing my presentation today, I looked at what our current rates were. And at the moment, we have 34% of our members are actually having active treatment, and 66% of our members are healed and in their well leg regime, which it made a huge difference compared to our rates before. So our patient outcomes have greatly improved. Again, both are complex and simple. And I know we sort of talked about it's quite difficult to define, but in our enhanced service, we do have to define between complex and simple leg ulcers. But the healing rates were, again, very positive in a short space of time. And generally, our overall healing rate is about 64%. But the one thing that really came across to me, and I think that the others of my team that work there, is the patient empowerment and how they really changed with the leg club. We can have all the facts and figures, but for me, the real passion that's come out of the leg club is how it's changed people's lives. We have a very social club, and how lovely it is for my volunteers to have won the award last night. Truly deserved, because they are absolutely fantastic in what they do. The volume and noise when you go into the leg club is just, it's like it is when you're out there. It's just so buzzing. There's lots of, bearing in mind, like your leg clubs, most of the members there didn't know each other before they came. So there's been lots of new friendships that have come, that have developed, because obviously a lot of members have probably lived there for their lives. Actual fact, there was lots of recapturing of old friendships. Didn't realise they'd gone to school together. And one of our volunteers brought an old book of the old times of the local area, and some of them will just sit and just chat about the good old days. We do, each week, there's a golden ticket, which one of our members came up with the idea that it's £1 a ticket, and the ticket is drawn, that golden ticket's drawn on the day, and 50% of that goes to the leg club funds. So basically it pretty much pays for our hall rent, and the other 50% is won by the winner of the ticket, and they absolutely love it. They all come with their pounds each week. We do other activities. They do pick a card and tombolas. A monthly raffle, which again is very popular. We tend to normally think we have to have an extra member of staff on that day once a month, because the attendance rate is extremely high. again, the volunteers say that they do so many different activities. They've done visits to the garden. One of the volunteers jumped out of the plane simply so that she could fund an activity day to go to the garden centre all together, and about 50 of them went off to the garden centre and they had a fantastic day. But she was determined her fundraising from jumping out of the plane was simply for that. So what makes it work? And what's different? Basically, it's that patient engagement. It really, we say, the one theme that I've noticed today was all about that patient-centred care, and having the Leg Club encourages the patient to participate in their care. And it's very much more patient-led. When I sit in clinics, I feel it's all on my term. We tell the patient what time to come for their appointment. Are we running late? If we're running late, they have to wait for us. They come in, I work in GP surgery, they might have 10 or 15 minutes. We've just talked about that. How can you do a true holistic assessment in that time? So, but with the Leg Club, it turns it completely over. It's on their terms because they can turn up at any time. So if they want to come in at 10 o'clock, that's when they come, or they want to get there first thing in the morning. I'm sure those of you who run Leg Clubs are probably like ours. We start at 9, they're queuing outside the door from about 8 o'clock. But that's their choice. That's what they want to do. So it's all on their terms. And if we need to give them longer, they have as long as they need, within reason. But we can give them the longer if for some reason that week they need that extra care, because you're working as a team. So it completely turns it around. They share and they learn from others, unless you've experienced ulceration, how can you truly say what it's like? And to watch the experience going on and the sharing of their experiences, I found absolutely amazing to watch, and that's really inspiring how they help each other out with their health issues. So they're really empowered, I believe, within a Leg Club. So they have an improved understanding of their care because there's more time to discuss it, and that discussion involves them. It might involve your colleagues, but they're there at the centre. So there may be two of you talking, but with the patient. And again, I think they feel very much more that they're able to make those decisions because it's not such a threatening environment as maybe in a clinic, when again it's on our terms as clinicians. So it's a true partnership. They really are stakeholders in their care and in the Leg Club. And the one element for me that really, really sold me on the Leg Club model was the well leg regime. As I was talking about, I needed to stop that cycle. We all know those patients that will see again, and I really felt we need to do something different. So the great model, the model of the Leg Club, to have that well leg regime, to know that those members, their patients, can keep coming. It doesn't stop when they're healed, and you can continue to educate them and their carers and their friends. So it also, the one thing that really inspired me as well was noticing when someone comes in and they're very low, and some of ours had that sort of hunched over, very low, very down, and watching them develop and change, and they become, they turn up with their hair brushed, washed. We've had people, they come in their clean shirts, and suddenly they have a place in the world. They don't feel stigmatised about their condition. They can come somewhere they feel really, really comfortable. And again, unless you've experienced that leg ulcer, you don't know what it's like to live with it. But they're there with other people who do know. And again, so that loneliness, we do have some members, and I'm sure others out there who do run Leg Clubs are exactly the same. Their only outing in the week is to come to the Leg Club. And one of the very passionate things one of the things I was passionate about was to try and reach those ones that my district nurse colleagues were seeing that are deemed as being housebound, but are they truly housebound? They're not. They just have mobility needs. So we try to pick as many as we can from them. And we have a minibus, which has again been fundraised for, which is disabled access. So they can come with their wheelchairs, they can come with their Zimmer frames, but that may be the only time they get out, but for them, it's the highlight of the week. And I believe that really makes a difference. So we try to so the Leg Club model can really turn their health belief. They believe they're going to get better, really turn it around so they have much positive beliefs. And also that behaviour. One gentleman that we had who was only about in his 50s, he was coming to the practice 5 times a week for an hour a week. In fact, he'd been to every specialist and still there was no change. And he was a patient. He was 50, he should have been at work. He had no other health problems, unfortunately, other than obesity, but he should have been at work. There should no reason for him to be off work. Yet he had become that patient. His whole life was about coming in to the surgery for that hour every day to have his legs dressed. And with encouraging him to come to the Leg Club and working together, he is now healed. He's actually even had a gastric band done. So not that he's lost a huge amount of weight, but he's healed, his legs are healed, and he's stayed healed. He still comes to see us every 3 or 4 weeks, and he's stayed healed. But he had been coming for 3 years, and nothing had changed. And our clinical care is exactly the same as what we were doing in practice. The only difference is we were able to change his behaviour and his health beliefs through the Leg Club model. So we talked about, it's been talked about quality of life, and we all know that there are patients that we can't heal. So we have to understand that we can't heal them, but we can make a difference and we can improve their quality of life. And for me, it's not, I'm going to be a bit devil's advocate, it's not just about the healing rates, it's just not about the financial benefits, it's about what a difference it makes to their life. And I was hoping to share today, but it hasn't all come together. We have just done a research. We had ethic approval through the Leg Club Foundation about looking at the quality of life and how the Leg Club model, what a difference it makes to them. I have been told that the results are very positive, so hopefully that will be published in very shortly. And the other thing, again, for example, our volunteers last night winning their award, because it's community focused, it doesn't only just have an impact on those patients that have lower legs, it has an impact much wider to the local community. A lot of our volunteers, they may be quite lonely themselves. For example, this week I had a phone call from a lady who was a carer for her mother. And again, she's only about 60, and she phoned me up and said, I've been told by my GP to give you a call because I need a direction in life, I need to do something. And I've been advised that maybe coming and helping in the Leg Club would help me and benefit me and give me some direction. And so, it has a much wider impact, not just for your patients with the lower leg. It brings all those communities together. So just to sort of capture on what I feel, and again, this is my personal view of what the qualities of a Leg Club are, it's that unique partnership. As I say, for me, it's the one model that I feel is truly, truly holistic. I always thought, up to sort of 3 years ago, that I gave holistic care. And I did to a certain extent, but I really feel the model really encompasses what is holistic care and patient-focused care, because it's very different to the traditional clinician and nurse relationship, which generally, to a certain extent, implies a more passive role for the patient. And I think the one thing that I would probably say all of us have found is that we get to know our members so much better in the Leg Club than we did before when we were in that clinical setting. We have a much greater understanding of what's going on in their lives. And and which obviously can make a huge impact to them, their well-being and their healing. So it really can make a difference to know everything about the patient, and you have a really different relationship. Hopefully it really helps to reduce and remove the barriers and of the stigmatization of such conditions, and they get that peer support. And one of our again, a gentleman who was very much a loner, and we managed to persuade him to come to the leg club. He'd never take his coat and his hat off, and he'd always sit there for quite a few months on his own, but every time we spoke to him, he was as happy as anything, and he said, "This makes me realise I'm not alone, and there are other people with the same condition as me." And he had been a real loner up until that point, but he still came every single week once he started coming. So we obviously also promotes independence and well-being. So again, if they were struggling with their hosiery, they can come each week and just say, how do I get it on? Can you show me other ways? And you can promote, you get much more time, which we never got in surgery, to see them again and again. Whereas in the leg club model, under the Well Leg, we can do that. Obviously, fitting very much within sort of the current NHS theme is that integrated working. And what I feel is it really has given us a basis. Again, we've probably got to know our community teams much better, and therefore we can work together with common goals. And hopefully, probably in today's NHS, that's going to be taken into lots of different areas. I know, obviously, there's lots of discussion. Primary care is going to change hugely over the next few years. But it's given us an avenue to say this can work. We can really work together for our patients. And that really comes into a couple of times we've had where patients become ill. They've been coming to the leg club and they've become ill, and therefore they haven't been able to attend. But our district nurse colleagues who also come to the leg club can go out and see them at home, and we can share that care. So when the patient comes back to the leg club, we know exactly what's gone on, that it's going to be the same nurses that have been helping to deliver that care. So there's that really integrated approach. It encourages enhanced relationships with other members of the multidisciplinary team. I have lots of ideas, and we're trying at the moment to try and get we do have podiatrists, a private podiatrist at the moment that offers foot care, but I want to work with our diabetic podiatry, because a lot of our members are diabetics, and they have feet problem and they need that care, and again they need that education. So our local consultant podiatrist is very keen. We've met and we're looking at ways how can we get diabetic podiatry to come and work with us in the leg club to provide that whole holistic approach there and multidisciplinary approach. And dietitians, I know that they can often be involved. So there's lots of it's a great forum for that multidisciplinary working. And again, we've obviously touched on today about shared learning and expertise. And I really feel that the leg club gives us that forum so that we can all make sure we are delivering the same care wherever we work within our community. We all have the same training, and we can share our experiences, and we can discuss those in a very open and supportive learning environment. We get contacted. We have very good relationships with our local university, and we get both pre and post grad students that come through, and our pre-reg students often come for the day, and they always want to come. We've heard about your leg club, we want to come there. So it's great. It's a great learning environment. So basically, pretty much as I said, how does it fit into the current NHS agenda? It encompasses lots of healthcare policies, and I'm sure we can all sit here and think of lots, because it enhances the quality of life with patients with long-term conditions, and very much encouraging that self-support. It's that early intervention, again, another part of the NHS agenda, getting in there early, reducing exacerbations, and therefore hopefully reducing the knock-on effect of that, of emissions. So it really does encompass that. It's proactive. That's what the NHS wants to be. It wants to be proactive, and we should be. One of my passions about it is I've been working with my local commissioning group to say, and I said to them, why are you throwing money constantly at these treatments with your enhanced service? You're just giving money every time. So, you know, if the patient doesn't heal in 6 months, you're going to give them another 6 months of money. If they don't heal then, you're giving them another 12 months of worth of money. Why? Why don't you turn that round and say, well, actual fact, yeah, you get some, but actual fact, you're paid for prevention and keeping them well. Get them healed quick, the ones that you can do, and get that the funds for keeping them well. And I really think the NHS really needs to turn things around, and hopefully that's what we're seeing. And quite interestingly, I can't remember who it was. I think it was Zena and Jackie that said talking about throwing money down the pot. To me, that was throwing money away. You know, you're just constantly paying maybe for not necessarily poor care, but maybe poor management, and not looking at different ways of working, when you should actually be investing that into prevention. And, you know, and obviously sometimes if you do well, you get your money cut, which is so wrong. You should be being rewarded for doing well, and, you know, because of the cost, the amount that you're saving on emissions, maybe amputations, whatever it might be, you are saving so much money, and in the NHS we should be rewarded for that. So I really feel that it should change it around. Obviously fits within social prescribing. That's a huge NHS on the NHS agenda, which obviously reduces isolation and loneliness. And we know then that everyone is treated the same. We were talking earlier again about, it depends where you live, what services are available. It's that postcode lottery. But if you have a leg club, you know that they'll be treated to the same standard for that area. Everyone will be treated. And we've actually had calls to our surgeries saying, we've heard you've got a leg club, we want to move surgeries, we want to register with you because, or how can I get it, how can we get it for our surgery to be involved, and that. So patients hear about it, and they really are empowered by it, and, you know, they're such a good voice. So hopefully they can help us have more leg clubs. And, you know, it's just something that really is passionate about prevention. We should be preventing. We shouldn't be reactive. We shouldn't wait till people have these chronic problems or problems that have become chronic. We need to be working on prevention. So just a few pictures of our wonderful volunteer team in their purple tops. Our local pub sponsored us for the tops. They haven't got their logo on there, but they wanted to be involved in the community. As I say, it's a community focus, it gets a very busy leg club. So just a few pictures. So just to summarise, before hopefully we can be on our way, I feel that the leg clubs are a true holistic approach to lower leg care, which differs. I'm not saying traditional methods aren't needed, but it's different, and it gives patients the option of going to something that may work better for them. It certainly demonstrates significant improvements in quality of life markers, and we talked about sort of the 5 domains, not just pain. It's about what really makes a difference in their life, their self-esteem, their mood, reducing their social isolation. Lots of different ways that we need to look at quality. We don't just want to look at the healing rates and reoccurrence. We need to look at the much bigger picture. It's very much patient-led, and encourages them with their self-care, and therefore that then improves your healing rates and reduces your reoccurrence, because they want to heal and they want to stay healed, and they have that opportunity to keep coming back and making sure they don't reoccur. So generally, I feel it really fits within the NHS agenda of health promotion and social prescribing, and also with the integrated team working, so that we've got a common approach and we're working together to improve care, and very much community focused. So thank you for listening.